Hi all, hope everybody is fine. Today my topic of discussion is from microbiology, the tetanus essay. Okay, let's get started. Okay, tetanus is eighth day disease. Why? Let me tell you later. Okay, tetanus caused by an causative organism called Clostridium tetani. It is an obligate anaerobe. In gram staining, it is gram-positive bacillus, drumstick appearance in microscopy. Distribution is soil, hospital environment, and the intestine of man and animal. Pathogenesis. The pathogenesis due to the virulence factor of tetani by the two exotoxin. Yeah, two exotoxin. The first one is tetanolysin and tetanospasmin. Tetanolysin is hemolysis, non-pathogenic. Tetanospasmin is pathogenic and it is otherwise known as tetanus toxin. The tetanospasmin is neurotoxin, causes diseases. The tetanus toxin plus formaldehyde produces toxoid, which we can use as vaccine preparation. Okay, moving into the mechanism of tetanus toxin, how the tetanus causing disease in humans. First, the tetanus toxin reacts with our motor nerve terminal, that is polycyanoglycoside receptor, which is present in motor nerve terminal, and it gets internalized by retrograde transportation, and it's blocked the gamma and glycine inhibiting nerve terminal. Ultimately, it prevents presynaptic release of inhibitory neurotransmitter, which causes the peculiar feature spastic muscle contraction. Okay, spastic muscle contraction. Okay, the how the tetanus toxin is transmitted from one person to other person via injury, surgery that is undergone with aseptic conditions, and otitis media, otogenic toxins, and neonates, that is injury, surgery, otitis media, and neonates. Eassy, the mnemonic is Eassy. Okay, there is no person to person transmission, only through this environment. From human there is a transmission, from person to person there is no transmission. Okay, let's get into the clinical manifestation. First, we have to know the incubation period. The incubation period of tetanus is 6 to 10. Tetanus, it's 10, right? 10 tetanus, so 10 days. Well, approximately you put the first number. Okay, 6 days, 6 to 10 days. And the peculiar feature of tetanus is trismus, lockjaw. Okay, painful muscle contraction. There is localized and generalized. In localized, affected limb, that is localized. In generalized, there is descending spastic paralysis throughout the body, and hand, feet, spat, and mentation is unimpaired. Sorry, I made a mistake here. Unimpaired. Okay, and the tendon reflexes are overactive or exaggerated. Okay, I say no. Why the tetanus is called eighth day disease? Here is the answer. Eighth day disease, from starting of the second week, that is eighth week, eighth day. Okay, the manifestations going to be very severe. You remember like systems CNS, CVS, GIT, RS, and excretion. In CNS, autonomic disturbances are there. There is maximal autonomic disturbances. In CVS, there is increased heart rate. In GIT, stasis, there is spastic paralysis, right? So intestine is not going to perform the peristalsis, and also intestinal stasis occurs, and generalized sweating is there. Okay, and RS lung, there is increased tracheal secretion. Okay, there is acute renal failure also. Okay, coming to the complication of tetanus, there is two features. Okay, rhizus sartonicus, opisthotonous position. What is rhizus? Rhizorius, you studied in anatomy and all, right? Rhizorius, that is the muscle used in laughing, that is rhizorius. So rhizus sartorius. Sartonicus is raised elbow and grinning of teeth. Let me attach the picture of it. Okay, which is abnormal sustained spasm of facial muscles that appears to be produce grinning. I will put the picture here. Okay, don't worry. Opisthotonous position. Opisthotonous position is an abnormal body posture. It is due to the generalized extensor muscle spastic contraction. okay, and respiratory muscle spasm, which causes airway obstruction, which produces major complications over there. Okay, the important part in microbiology is lab diagnosis. In lab diagnosis, the specimen taken from wound swab, excised tissue bites from necrotic dips of wound. Generally, you put wound, okay. In gram staining, already I said you gram positive bacillus, and there is drumstick like appearance. Drumstick, no, you know, right? Drumstick. One which is used for producing music and all, drumstick. That is drumstick like appearance, okay. You don't think of vegetable drumstick, it is a drumstick like appearance. Okay, what are the other organisms which resembles the drumstick appearance of tetanus are Clostridium tetanomorphum, Clostridium spinodynes, okay. These two organisms are non-pathogenic, so we don't have to worry about these two people. Okay, we taken the swab, we extracted the organism, we have to culture that, right? We are using two culture media, Robertson cooked broth and blood agar with polymyxin B. In Robertson cooked broth, meat is taken, okay, the Clostridium tetanus, which is proteolytic in nature. It causes proteolysis in meat and produces black and foul odor. In blood agar with polymyxin B, we have to incubate it at 37 degree Celsius for 1 to 2 days, okay. We have to produce anaerobic condition, and the Clostridium tetanus produces swarming growth over there. You have to remember the main two culture media, Robertson cooked meat broth and blood agar with polymyxin B, okay. Okay, the other test, okay, toxigenicity test, which is toxin mediated, so toxin assay should be done. Toxin assay is done in vivo mouse incubation test. The serum taken, the specimen taken or serum and the urine. Okay, let's get into the management part, okay. Tetanus management is of two types, passive immunization and combined immunization, which is active plus passive. And in passive immunization, there are two preparations, ITIG and ATS. ITIG is human tetanus immunoglobulin, ATS is anti-tetanus serum, okay. This is extracted from the human, the person who previously infected with tetanus. There is a production of antibody and all, right? From there we are preparing this HTIG, and the ATS is derived from horse, anti-tetanus serum. So we are preferring this HTIG over ATS because of serum sickness anaphylactic reactions, okay. Combined immunization is active plus passive. The injection put at one arm at tetanus toxin and the other arm is ATS or HTIG, okay. In antibiotics part, which is useful in early infection and prevent release of toxin, the choice of drug is metronidazole, penicillin, and doxycycline. Okay. The symptomatic treatment is we already know airway obstruction, reflux spasm, and control the sympathetic hyperactivity. For treating airway obstruction, we are gonna using endotracheal intubation and early tracheostomy. For reflux spasm, we are using antispasmodic drugs like diazepam. For controlling sympathetic hyperactivity, we are using beta blockers, and surgical debridement is also required. Coming to the prevention part, okay, this is the last slide, okay. Prevention part, the active immunization is through vaccination, combined vaccination. You people already written SPM, the DPT vaccine, DT vaccine, and Pentavac vaccine. Pentavac vaccine comprises of 5 ingredients, that is DPT, hepatitis B, and Haemophilus influenza type B, okay. You should never forget this, okay. Okay, the site of vaccination is anterolateral aspect of the thigh in children and deltoid in the adult. Okay, prevention of tetanus after injury. Okay, we got injury. How we have to prevent the tetanus? They have given tabular column. We are going to see now. Okay, a complete course of vaccination taken within 5 years. The wound is not tetanus prone means this column, and wound is tetanus prone means this column. Okay, let me explain. Complete course of vaccine taken within 5 years. The patient or the people after injury he have gone 5 years a period of vaccination. There is no requirement of any treatment and all, okay, prevention and all, because the vaccine itself is effective in this condition. The patient has complete course of vaccination taken within 5 years up to 10 years, okay. He has taken the vaccination 5 to 10 years between this period. There's a requirement of TD1 dose and TD1 dose also here. For if it is tetanus with or the wound is with or without tetanus, we have to give him tetanus 1 dose tox vaccine. He have long back taken the vaccination, so we have to, if it is not prone for tetanus, we have to give tetanus 1 dose for prevention, okay. For it is tetanus prone wound means we have to given him tetanus 1 dose plus HTIG. We have discussed no here HTIG that we have to given here, okay. Unknown or incomplete immunization, the patient itself don't know whether he's taken tetanus vaccine or he haven't undergone any vaccination. We have to give him complete tetanus dosage form, and here also we have to complete tetanus dosage form we have to given, plus human tetanus immunoglobulins also we have to give, okay. Okay everyone, thank you, hope this video is helpful. Let's meet in another video. Bye.